Woman with stage 3 kidney disease. Following doctor's advice to eat healthier, made large spinach salad for lunch, added tomatoes, beets, Swiss chard from her garden, all vegetables, all considered healthy. That evening, weakness, heart palpitations, difficulty breathing, emergency room, blood test result, potassium 7.2, dangerously high, normal is 3.5 to 5.0, diagnosis, hyperkalemia from dietary potassium overload, treatment, emergency medication to stabilize heart rhythm. How did a healthy salad land her in the ER? Every ingredient she chose was high potassium vegetable. Spinach, 839 milligrams potassium per cup. Swiss chard, 961 milligrams. Beet greens, 1,309 milligrams. Tomato, 427 milligrams. One salad, over 3,000 milligrams of potassium. For someone with healthy kidneys, not a problem. Kidneys easily excrete excess potassium. For someone with kidney disease, potentially life-threatening. Damaged kidneys can't remove potassium efficiently. Level builds in blood. Disrupts heart rhythm. 4 vegetables commonly recommended for general health are specifically problematic for kidney disease. Today, the 4 vegetables to avoid or severely limit. Why each one dangerous? The safe alternatives that provide same nutrients, and how to know your individual tolerance. Now, before we move on, a quick reminder. This video is for educational purposes only. It's not medical advice, and you should always work with your doctor or registered dietitian to create a kidney diet appropriate for your specific stage of disease. Potassium restrictions vary significantly between individuals and disease stages. And if you'd like a free kidney-safe vegetable swap guide, just comment the word swap below. You'll find the link waiting in the pinned comment. It's a simple chart showing high potassium vegetables to avoid and low potassium alternatives to choose instead. Now, let's talk about the 4 vegetables that are problematic for kidney disease. Vegetable number 1, spinach, both raw and cooked. Spinach is nutritional powerhouse for general population, rich in iron, vitamins A and C, folate, antioxidants. Standard health advice: eat more spinach. Add it to smoothies, make spinach salads, cook it as side dish. But for kidney disease patients, spinach presents 2 major problems. Problem 1, extremely high potassium content. 1 cup of cooked spinach, 839 milligrams of potassium. For comparison, recommended potassium limit for stage 3 or 4 kidney disease is typically 2,000 to 2,500 milligrams per day total. Single serving of cooked spinach provides 33 to 42% of entire day's safe potassium limit. Raw spinach slightly lower, 167 milligrams per cup. But who eats just 1 cup of raw spinach in a salad? Typical spinach salad contains 3 to 4 cups. That's 500 to 668 milligrams. Problem 2, very high oxalate content. Spinach contains approximately 750 milligrams of oxalate per cup. Oxalates are compounds that bind with calcium to form crystals. These crystals can deposit in kidneys, forming stones. Research from Kidney International, chronic kidney disease patients with high oxalate intake had 47% higher rate of kidney stone formation compared to those limiting oxalates. Kidney stones in CKD patients can accelerate kidney damage and cause additional complications. The kidney-safe alternative: arugula, romaine lettuce, or cabbage. Arugula, 74 milligrams potassium per cup raw. Low oxalate. Romaine lettuce, 116 milligrams potassium per cup. Low oxalate. Green cabbage, 119 milligrams potassium per cup cooked. Low oxalate. These provide vitamins and fiber without potassium or oxalate overload. If you're used to spinach salads, switch to arugula or romaine. Same satisfying greens experience, 80 to 90% less potassium. Vegetable number 2, Swiss chard. Beautiful vegetable, colorful stems in red, yellow, orange. Featured in gourmet cooking, considered superfood. 1 cup cooked Swiss chard, 961 milligrams of potassium. Even higher than spinach, nearly half the daily safe limit for kidney patients in single serving. Why is Swiss chard so high in potassium? Leafy greens in general concentrate minerals from soil. Swiss chard particularly efficient at absorbing potassium. When you cook leafy greens, they reduce in volume dramatically. What starts as large bunch becomes single cup when cooked. All that potassium concentrates into smaller serving. Study from National Kidney Foundation. Cooked leafy greens were leading dietary source of excess potassium in CKD patients who experienced hyperkalemia. Not because patients eating unreasonable amounts, because standard serving sizes of these vegetables contain potassium levels damaged kidneys cannot handle. Additionally, Swiss chard contains moderate levels of oxalates, not as high as spinach, but still concerning for kidney stone-prone patients. The kidney-safe alternative, bok choy or green beans. Bok choy, 631 milligrams potassium per cup cooked. Still significant, but 34% less than Swiss chard. Moderate oxalate. Green beans, 209 milligrams potassium per cup cooked. Very low, minimal oxalate. If you want cooked greens as side dish, green beans provide satisfying vegetable serving with 78% less potassium than Swiss chard. Preparation tip. If you occasionally want to eat higher potassium vegetables, leaching method can help. Cut vegetables small, soak in warm water for 2 hours, drain, cook in fresh water. This removes 30 to 50% of potassium. Not perfect solution, but reduces risk. Vegetable number 3, beets and beet greens. Beets have become trendy health food. Beet juice marketed for athletic performance, roasted beets featured in restaurant salads. Beet greens promoted as nutrient-dense cooking green. The problem: both the root and the greens are extremely high in potassium. Beet greens, cooked, 309 milligrams potassium per cup. This is highest potassium content of any commonly eaten vegetable. Single serving provides 52 to 65% of safe daily potassium limit for kidney patient. The beetroot itself, 519 milligrams potassium per cup cooked. Lower than greens, but still high category. Additionally, both beets and beet greens high in oxalates. Beets contain 152 milligrams oxalate per cup. Beet greens even higher. Research from American Journal of Kidney Diseases, beet consumption identified as risk factor for hyperkalemia in dialysis patients and late-stage CKD patients. Why do people with kidney disease eat beets despite high potassium? Because beets marketed as blood pressure lowering food. They contain nitrates that convert to nitric oxide, which dilates blood vessels. Many kidney patients have high blood pressure. See health articles about beets lowering blood pressure. Think beets are good choice. Don't realize that for damaged kidneys, the potassium risk outweighs blood pressure benefit. The kidney-safe alternatives, cauliflower or radishes. Cauliflower, 176 milligrams potassium per cup cooked. Low oxalate. Can be roasted for similar texture to roasted beets. Radishes, 135 milligrams potassium per cup sliced. Low oxalate. Provide peppery flavor and crisp texture. If you like earthy flavor of beets, roasted radishes develop similar sweetness with 87% less potassium. Vegetable number 4, tomatoes, particularly tomato sauce paste and juice. Fresh tomatoes moderate potassium. 1 medium tomato, 427 milligrams. Not extremely high, but most people don't eat tomatoes alone. They eat them in sauces, soups, stews, and this is where tomatoes become problematic. Tomato sauce, 728 milligrams potassium per cup. Tomato paste, 1,065 milligrams potassium per half cup. Tomato juice, 556 milligrams potassium per cup. Why such dramatic increase? Tomato products are concentrated. Multiple tomatoes cooked down into smaller volume. All the potassium from many tomatoes concentrated into single serving. Italian meal example, pasta with marinara sauce. Typical restaurant serving uses 1 to 1.5 cup sauce. That's 728 to 1,092 milligrams potassium. Plus pasta itself adds more, plus any cheese. Single meal can easily exceed entire day's safe potassium limit. Study from Journal of Renal Nutrition examined dietary sources of potassium in CKD patients. Finding: tomato-based products were second leading source of excess dietary potassium after potatoes. Many patients unaware because they think of tomatoes as vegetables, not high potassium food. Additional concern. Acidic nature of tomatoes can be hard on digestive system for some kidney patients, especially those on multiple medications. The kidney-safe alternatives: red bell peppers or cucumbers. Red bell pepper, 251 milligrams potassium per cup chopped, less than half a fresh tomato, can be roasted and blended into pasta sauce, provides similar color and some sweetness without potassium load. Cucumber, 152 milligrams potassium per cup, very low. For fresh tomato in salads, cucumber provides crunch and freshness with 64% less potassium. For pasta sauce, small amounts of tomato paste for flavor, bulked up with red bell pepper, garlic, herbs, significantly reduces potassium while maintaining tomato flavor. Let's step back and understand why potassium becomes dangerous when kidneys are damaged. Healthy kidneys regulate potassium balance. When you eat potassium-rich food, excess filtered into urine and eliminated. Blood potassium stays in safe range, 3.5 to 5.0 millimoles per liter. But kidneys operating at reduced function can't filter potassium efficiently. Stage 3 kidney disease. Kidneys functioning at 30 to 60% capacity. Stage 4, 15 to 30% capacity. At these levels, potassium elimination significantly impaired. Result: potassium accumulates in blood. Medical term: hyperkalemia. Mild hyperkalemia, 5.5 to 6.0. May cause no symptoms, but indicates kidneys struggling. Moderate hyperkalemia, 6.0 to 6.5, can cause muscle weakness, fatigue, nausea. Severe hyperkalemia, above 6.5, dangerous, can cause heart rhythm abnormalities, cardiac arrest. Research from American Heart Association: elevated potassium disrupts electrical signals that control heartbeat, can cause heart to beat too slowly, irregularly, or stop suddenly. This is why the woman in our opening story ended up in ER. Potassium of 7.2 put her at immediate cardiac risk. Important clarification: not everyone with kidney disease needs identical potassium restriction. Early stage CKD, stage 1 or 2. Often no potassium restriction needed. Kidneys still filtering adequately. Stage 3, moderate restriction, typically 2,000 to 3,000 milligrams daily. Stage 4 and 5, stricter restriction, often 2,000 milligrams or less. This is why working with dietitian is essential. Your restriction depends on your specific kidney function, measured by eGFR and blood potassium levels. Some stage 3 patients can tolerate occasional higher potassium vegetable. Others need strict limits even in early stages. Blood work determines your individual tolerance. Let's recap the 4 vegetables to avoid or severely limit with kidney disease. 1. Spinach, 839 milligrams potassium per cup cooked. 750 milligrams oxalate. Replace with arugula, romaine, or cabbage. 2. Swiss chard, 961 milligrams potassium per cup cooked. Replace with bok choy or green beans. 3. Beets and beet greens. Greens, 309 milligrams per cup. Roots, 519 milligrams per cup. High oxalate. Replace with cauliflower or radishes. 4. Tomatoes, especially processed. Sauce, 728 milligrams per cup. Paste, 1,065 per half cup. Replace with red bell peppers or use small amounts with peppers. Important points to remember. Point 1. These vegetables aren't unhealthy. They're healthy for people with normal kidney function, just problematic for reduced kidney function. Point 2. Your individual restriction depends on your kidney function stage. Work with nephrologist and dietitian to determine your specific limits. Point 3. Blood work guides your diet. Regular potassium level monitoring tells you if diet changes are working. Point 4. Occasional small serving of higher potassium vegetable may be acceptable depending on your stage, but daily consumption risky. Point 5. Preparation methods matter. Leaching vegetables in water before cooking removes 30 to 50% of potassium. The practical approach? Focus on what you can eat, not just what you can't. Many delicious, nutritious vegetables are kidney safe. Green beans, cabbage, cauliflower, bell peppers, cucumbers, radishes, lettuce, zucchini, eggplant, onions, garlic. These provide vitamins, fiber, antioxidants without potassium overload. Kidney-friendly eating doesn't mean no vegetables. It means choosing different vegetables. Remember, comment swap for your free kidney-safe vegetable swap guide with complete lists and serving sizes. If this was helpful, tap like and share with anyone managing chronic kidney disease. Subscribe because next week we're covering the 5 foods that research shows may actually support kidney function and slow disease progression. These 4 vegetables to avoid, dozens of vegetables to enjoy. Your kidney health, your informed choices, your dietary control.